Hi, my name is Michael Fraley, and I'm the coordinator for the North Central Regional Trauma Advisory Council. Being hospital providers, you're probably well aware of how painful and difficult to manage pressure ulcers can be. But were you aware that hospital-acquired pressure ulcers cost about $3 billion a year to treat, and they increase the length of stay for patients by 2 to 5 times? The North Central Regional Trauma Advisory Council is supporting a project to help reduce the incidence of skin breakdown on patients transferred on a backboard to a higher level trauma center. The tissue changes that become pressure ulcers begin in as little as 20 minutes of being on a hard backboard. We've provided each level 3 and 4 hospital in our region with a supply of the Thomas Back Raft and a few of the hand pumps. All we ask is that when you are transferring a trauma patient to a higher level trauma center and they're still on a backboard, to document the patient's skin condition before transfer and use some form of padding, such as the Thomas Back Raft, on the board. The patient's skin condition will be documented again when they get to the destination hospital. Then the trauma registrars will collect the data and report it to the NCRTAC Performance Improvement Committee. Our goal is that 100% of patients transported on a backboard will have padding and that none of them will develop any skin breakdown. Follow along as we prepare a few patients for transfer. Our first scenario is a patient that came in via EMS already on a long backboard. And either during your initial assessment, if you recognize that the patient is a major trauma patient and you know that they're going to be transported, or after the decision's been made, we want to put some sort of padding like the back raft in place. What we'll do is, while holding manual C-spine, roll the patient up.
Are you ready? 1, 2, 3.
Place the back raft on the board. You can use the loops at the top and the adhesive tape at the bottom if you want to. You don't necessarily need to. That's mainly for while the patient's being moved a lot. Inspect the back, see if there's any skin breakdown issues currently. The back raft is deflated at this moment. All right, roll them back down.
1, 2, 3.
Then we'll inflate the raft. Now the valve on the raft is kind of backwards to what you would normally think of. When it's parallel with the line, it's closed. It's done that way so that it's not actually bumped and opened. So when it looks like a T or a cross, then it's actually open. So now we'll inflate this using the hand pump. You only need to inflate just to kind of fill the voids. You might see the shoulders rise a little bit, or the patient say that it's more comfortable. Close the valve. Now we can re-secure the patient, pad any other bony prominences, and prepare for transport. In this scenario, the patient came in either by private vehicle or didn't have a backboard in place to begin with, and we need to put one before transfer. So we're going to take the long backboard, put the back raft in place, loop the 2 tabs over the top, and there's a piece of tape at the bottom. You just remove the adhesive cover, stick it to the board, leave the raft deflated, and prepare to roll the patient.
Ready?
Okay.
All right. 1, 2, 3.
Roll the patient up, inspect the back, look for any skin issues to begin with. Okay.
1, 2, 3. Inflate the raft. Again, just looking that the voids are filled and see the shoulders just start to raise just a little bit. The patient might also be able to let you know that it's more comfortable. Re-secure the straps. Document that padding was placed, the skin condition, and you're ready to go. That's all there is to it. Don't forget to document the patient's skin condition and that you place padding. Thank you for making the patient more comfortable and less at risk for skin breakdown. Learn more about the North Central Regional Trauma Advisory Council at NCRTAC-WI.org or find us on Facebook.